Okay, guys, this is Dr. Sean over at the Center Path, and we're going to talk a little bit more about meditation, the physiology of meditation. Do you drool when you meditate or when you chant? There's a reason for that. So if you start drooling or you hear your stomach grumbling or you start noticing you're nodding off or you feel very, very warm, okay, especially in your face or your head, and drooling is probably the biggest one, or you feel like you want to really sigh, okay, and you can't catch your breath and it's kind of like distracting, there's an actual reason for that. And it's a great sign in meditation and mindfulness practice. What we're looking at is the activation of the parasympathetic nervous system. The parasympathetic and the sympathetic nervous system are two parts of what's called the autonomic. Think of automatic nervous system. It's a peripheral part of the nervous system because you have your central part, which is the brain and the spinal cord, and then there's branches from that which come off, and those become the peripheral nervous system. Now there is a motor and a sensory version, of course, that come off through the spine, and those become the cervical plexus, the brachial plexus, the lumbar plexus, the lumbopelvic plexus, which are and the celiac plexus and other different areas where groups of nerves serve different things for either sensory issues, sending information back, that's called afferent, okay, or efferent, like motor telling it what to do. But wait, there's more. There's the sympathetic and parasympathetic, the autonomic nervous system. The parasympathetic has branches that go straight off the brain and the spinal cord up high, and the sacrum down low, right at the base of the spine. And those go to the organs of the thorax, okay, this area, so the heart, the pericardium, the large vessels, the lungs, the bronchioles. It goes to the diaphragm. Well, it doesn't go to the diaphragm. It's different muscle. We'll talk about that one. And it goes to like the stomach and the small intestine, the large intestine, the pancreas, the gallbladder, the liver, the spleen, the large intestine, the sigmoid colon, the bladder, and all of that stuff. And they have different actions. Now, generally in when you're learning this kind of stuff, if you're in anatomy or physiology class like the ones I teach, you're going to learn that parasympathetic is your resting, digesting, feeding, and breathing system. So it's rest. You feel at rest. You feel calm. Okay, your blood vessels have kind of opened up. Your bronchioles have opened up. You feel like, oh, okay, I'm nice and groovy and tired and relaxed. Resting, digesting. You just had a nice meal. How do you feel? You feel sleepy. Okay, feeding is when you eat, you feel like eating, your digestion's going good, you're releasing the right kind of chemicals, which is going to be saliva. That's from drooling, right? Saliva from the mouth to help you digest carbohydrates. You're going to release acids to help break down proteins. You're going to release a bunch of different proteases and lipases and things like that to break down fats and to break down proteins into amino acids and all the basic building blocks so that you can absorb them and use them. Okay, and then breathing. If you look at like sexual health, okay, so there's like erectile dysfunction and pelvic inflammatory, not pelvic inflammatory, but pelvic issues with women, sometimes perineal pain. That can be because the sympathetic nervous system is too high and the parasympathetic is too far down. A lot of fertility problems are because of that exact thing, is too much stress. They've shut down their digestion, their feeding, their breathing systems because it's considered not safe outside or inside or whatever. It's not safe. And so their bodies are not going to reproduce because that's not the way to go. Meditation can help that. Now, the other side of that coin, over here, I guess you'd say, is the sympathetic. The sympathetic comes from a group of nerves in the thoracic chain. It's a little chain of nerve bundles off the spine. They call the sympathetic nerves. Sympathetic is fight, flight, freeze, or faint. Okay, so it goes kind of all this whole thing. You can pass out. It bounces back into parasympathetic actually. It's kind of like a infinity kind of thing. They always interact with each other. But for fight or flight, aggression, fear aggression, which is a very important thing, we have our bodies go into this sympathetic overload. Our pupils will dilate to bring in more light. Our muscles will tense to let us run faster. Our vessels will close down to keep us from bleeding out if we get cut or scratched or bitten, and we'll be able to run. Okay, that's our flight and flee and that kind of stuff. We'll also be very good at being still. Fortunately, that also starts up the parasympathetic. And when you have to pee, if you've ever been chased by anybody, like you're running away from something like the cops or security or something like that, everybody always has to pee at that time. That's because you're trying to get rid of everything so you can really get a good run on. Anyway, back to the basics of meditation. When you're sitting and you're ratcheting down your sympathetic nervous system, you're parasympathetic can start to work again, and your stomach will grumble. And that's a great sign. That means your stomach is starting to wake up and come back to its normal activity. But there's nothing in there for it to work on at the time. Or maybe there's gas bubbles or whatever it is. The other thing, too, is you'll start creating a lot of drool, and you may even drool, and that can be very disturbing, but it's a good sign. It means you're on the right track. You were able to get into that parasympathetic. Many times we're doing like polyvagal